And in the department, it's a long transplant department, but also moonlight different places. Our next panelist will be our own very own physician assistant, Mr. Antonio Asiedu, who's currently practiced at Montefiore Medical Center in the Department of Surgery and Abdominal Transplant, and he has over 13 years of experience. Our next panelist will be our very own Dr. Bridget Azera, and then she is a board-certified medical doctor. She practiced with a team called Team Health, and she works all over the country. Our main speaker for the evening is our very own Dr. Barima Poku. He currently lives in Tennessee, but he graciously agreed to come and then give us this talk this evening. He is a practicing Catholic. He's currently married with 3 children, and he also worked formerly in Ghana as an OBGYN, and currently he's an internal medicine doctor in the United States. I'll advise everyone tonight to please keep quiet and then listen carefully. It's always advisable to get a pen and paper so you can take little notes. We will not have questions while the presentation is going on, but after the presentation, feel free to have all your questions. We don't have too much time, so I'm just gonna go ahead and leave the line over to Dr. Barima Poku, and may we give him a warm welcome, a CMA welcome. Thank you so much. Dr. Barima Poku, if you're available, we're ready for you.
Topica, Rebecca Safa, Rebecca Sam, most laba, my area. If you are not free, you can't back me any biafra. I can affirm my dear home. If you say, a center, Christian mothers, member kakra, munti. Or see, I come also dear be. And this is the kind, I mean, any path for the same air panelists, but medical team, Nina, a kind home. And tea. Miss Mensah, more yakasaka can't move. The kind, say, the Amunia Pie, Pasa Motemenka.
Yes, please.
Yes.
Okay, so, and the mode of communication should be more in Twi or more in English.
Both, please.
Okay.
Mostly true.
Yeah, so I think that the Amunia Pie mostly doing our yearly physicals, no. Or no, because yearly physicals, no. And if something wrong is happening to you. So if you do your yearly physicals, that's when we will know that if something is happening to your liver, and that something is happening to your kidneys. And we also look at your red blood cells and all those things. If it's going low, that one will lead us to ask you more questions for us to find out what is really wrong with you. And one thing to that we should be conversant office. And as I say, you have to make sure say your vaccinations and I say a panel one every year and it's up to date. Because obiwa nipa Abraham omunya floor and your moshe. Nanso, when nipa bako mienu bia. Na so omunya floor ebetimi ekuomo. Enti se onye allergic to flu, so flu panana saying how dear. Na say bia obetimi awo every year ebeboa. Bibi say COVID panier your uncle for is almost betimi awo. Bi say mpanimfo modi be 65 and I say oh ya repeat say cancer and I say ya rebia ete one who are so also every year be an over COVID panier. And I did about whom he say from her your Ghana is also be a challenge, but in this country we are able to do it. So we have to make good use of it. We have to make sure say we are doing age appropriate cancer screening. And I say if you do no, or say you have said be a cocram, I'll say because most of the time it's the screening that will let us see the disease. I tell me who you are no early stage, because most of the time cancer no early stage, and ultimately a treaty. Someone who you can't really treat it. Enti or say who in here ye. Enti ye kwa nimu no. Ye bedi kasa afa and some and as alcoholism. But you say Roma 4 there say you bet me a nom so yambo. First na it is but then saying if you about to say sensa onum ketewa bi kra na etimi how bebre enti so obetimi na obegya anum kra ye na obi so opɛ nsa yeah also ote so kra because nsa ya ade a onso timi ha adwen nsa no etimi ha ye liver anase ye brebo etimi ma akoma yare as heart disease that's cause a lot of cancers. Now cancers are nsa etimi ema na be a head and neck cancers. And na bibi say your cancer away minimum as of esophageal cancer and I say cancer higher brebo if liver cancer and as asthma etimi ma onyak breast cancer. And in cancer so etimi si wo yenstrom e friend colorectal cancer. Enti ensa first then yes utimi nom kakra but they say the human me so kitwa bia etimi ha. Enti so ubetimi agya a beboa beboa bobo ho ba ma sa ya nyoma nyina bi entimi enyo. Na ye beka sa fa cigarette no man na say tobacco use. Cigarette no it's great the audio because it's able to cause diseases from the head to the toe. So at my referee it TBC and cigarette there is not good. And I don't think say Ghanaians we are more into cigarettes like our other brothers who are here. Because only cigarette the amount their heart cancer can cause lung cancer there. Easily, and it can cause all sorts of heart diseases like heart attacks. It can let you have enlarged heart. It can also give you stroke. And cigarette, it can cause stroke and it can cause blood clots. Blood clots say added them. A bit me it me yes me to binsa. And I'm saying from multiple nasi or all over the body can cause cancers. Now, I did about to say, oh, your bass for him our dear coffin. And on the enya idea, I am cry, and it what dreams so I say cause cognitive function decline. When is over when you dementia. And cigarette normally there, I think say, enya they common with us in tea. By you make sure say we put a stop to that. Enti free hani etiesi yare anim enti yare ba ko ebeka akasa fa ho ye frɛ no cervical cancer anase cancer eye mba awodie no ano na cancer eye mba ye kam mba awodie ne dia cancer who the cancer is the most common cause of deaths in gynecological tumors. And all over the world, every year we have about 200,000 people who get the cervical cancer. And of the 200,000, about half, I say more half, about half of them die. And so if you take about 70 people, and that's all you buy your swan, and you quite be memo what they are on the cancer, a kun in bapa, the bia make cassava one. Makai, Mammy Pian in the area. I mean, your confanoche and all the be baho. I mean, any man, more jet to the Samo, we be on your own train. And tea. You can't remember what the end of Queen, papa. Nasa, yeah, when for answer pictures of how it looks like. So this is the womb. And this is the tip of the wound. So this is the cervix. So I had a and a start for the other one no kakrebi. Se one pen once a man can na fe edidiko wa wodi anim. Se la one pen once a man can na fe efi wa wodi anim kura akọ nyoma wo nchen. One pen once a man can afe etimi ba honam nyina etimi ba obo etimi kọ yem etimi kọ baabia etimi kọ etimi do wadwenem. Edu hon dia entimi nya ho hwe nti normally sa yare we no oyade oso hu ni ntem wetimi aso anu because hu ntem no so anu a hu timi to so yare we yare ba ko a ya hwe mo am hu say it's caused by infections because cancer about almost all of them are not caused by infection, but this one is caused by infection. So and the main character, that's a main the yarea de bapa friend HPV, only a virus, human papilloma virus, and omutiminya be infection be a oba ostate osrontem and I say bembusu na ostate mbema edi agro. Almost those who have multiple sexual partners, so your bar na so mbema those who also betimi anya bi. Ena your bar na wakoware bema bi na se bema no ansa wo ni bema bi wo na bema ne epemba. Also obetimi akofa sayare ni bi edi abesao. Ena sika no the yare nya o man member them as sexually transmitted diseases no most of the time they are mostly we call them mostly brothers because if you go and you are getting gonorrhea and that's syphilis and that's all the other ones no they come as groups. The HPV will be part of it and you all can also get HIV and HIV is it's also another disease and say obia onya sa sa cervical cancer no a lot. Enti CMC can say arrange na obi o we pese ehun ntem. Ti ebe na yehun ntem ne aso anu ama. Normally you have to do a screening. That's why I always say that you have to do the age appropriate screening. So with the screening, if you are less than 21 years, most of the time they don't do any screening. Now, some if you're near 21, if you're doing back, you're doing kunona. Or no, you'll be on friend pap smear, no color mafa. The idea kakra for our then no, they are called because say be cancer ni bi wo ho yeah, a lot of school of thought. Some people say you do it every year, and if it's normal for 3 years, you can go to every 3 years from 21 to 29 years. Others say you can do it every 3 years. Only 30 to 65 for the year, and your perhaps you know as what actually one more also sa cancer no. I from HPV no. Ono ye na say normal dear. You can do it every 5 years. But people say perhaps you no can still and you do it every 3 years. But me yes anyo me ya na so do 65 dear. Screen no ho nya enhie mo pa obetimi agyae. But so onye bi da no 65 dear still obetimi aye because unim say bia e sie wo ho a because amboa no nya edi be 20 to about 30 years and so no cancer no. Enti with 65 for no kon dia I mean na ye hu bi wo so I just said 20 to 35 years ne bia na yare foforo bi kura kun. The same thing can mostly no this condition is diagnosed with the pap smear no. Because that's what we are talking now. So that's what we want to do. So that you do it, you acquire pap smear and so the we are going to see it. And so one year pap smear no that's at one who check there and you might bet me, you might bet me actually I mean say bo who say na as a moja A2 and your period upon moja 2 rough. Ebiswa inswa efi wase ba hwe na nka kakra wom ebiswa wo he no ya ase ho eya oya bebre ojo nso so na ase ojo nso de ya but sa anwuma meke ka ho nya betimi aye arfofo but we so ya de so a so ba ka kasa no etimi edeba enti yeah so we are perhaps positive that one we do our other tests we have they have to take a big sample and take it to the lab to test. And they may do other tests, like even they will do CTs and MRIs to find out where the cancer has gotten to. And so the MC can so infection, so you can prevent the infection. That's like getting a vaccine to against COVID. No, so you can get a vaccine against the HPV. Up to 45 years, you can get the vaccine. And so only 45 years, because vaccine, at least you protect yourself from getting this disease. And CMC you have to your bar and it's only member be breeder and that's only bema be a pemba that's the bay of Benny and I say or and it's start here man some intem. If you say oh yeah man some to my possibility of Benyasa I be a high. And I some take HIV so to me the bar. And also also only HIV nibi. Oh, this why you have to make sure say you are going to be treated because HIV also can be treated. Yeah, and the RSS is can see who in term dear to me as no, but what can I say if I want them near the end to me and so I know. Because met me or who can be on bet me operation no more baby I ran away from who are to me travel out there and now out there no person but this was what I do baby so see you out there. And tia hun in term treatment no simple by hun in term emano hard drain. Yeah, call yare toss me no as a cancer toss me no so ha and buy ye. If I asking na breast cancer and the coon and bapa, but about the developed area like baby away cancer in banyan bebre, but second to lung cancer. When it comes to cancer deaths in women, because lung cancer no kuni man saying breast cancer, baby is America as a developed world, but what the call we are seeing in India, breast cancer no kumba, saying cancer beer. So breast cancer, so if you want say most of the time, oh year beer, but most of the time, yes, I come on by almost 50s and almost 70s. Na nyoma ben na timi ma onya bi say say obusuem say breast cancer wo ho a say you have a high chance maybe unwan bi answer mama bi na say or direct cousin bi anya bi you stand a higher chance of getting the breast cancer. That means that maybe in the family. And maybe say ovarian cancer and I say cancer ha de to kosua o ma to kosua o moyem no. So when you be no, so you stand a higher chance of getting the breast cancer because there are some genetic factors that they link the two together. And you have to know that you stand a higher chance of getting breast cancer. And you have to go and check because in that case, no one you become to me trial no phone so that be and yeah, in terms of someone ya brantem no timi enya breast cancer ni bi and almost for anwo kra no etimi bomb so and so when try brantem as a late age of menopause so to me bi and how you so oral contraceptives bebre and also etimi ma onya breast cancer ni bi and wow, so when you have previous history of breast cancer, if you got it in maybe on your left breast side, the possibility of some when you be or other breast no high. And say more do kakra so and also to me Emma out me be and I know say it more predisposed to me be and same sick and almighty tobacco and alcohol and also bet me I'm when you be in breast cancer no who say breast cancer I think that we are doing this one so that we'll be doing the screening. I think that's what was about screening. So if you do the screening there, most of the time you with the mammogram no you and sana asati how. But one year screening nasa show who the etimi on say obon say ubenya a lamp or breast him, and also bet me feel a drug that said out breast him. Now most of the time, a drug, most of them are normal, but if in your case, no, if you feel so feeling, I say I had the name is a boy, and I say it's attached to your skin. How beautiful skin no yeah. Then you have to know that one may be a bad bad lamp. I say a dry that way in no ya bonny. If you saw bones afi now for no first then shape city and afi na asisa kra. If you ha but na afi baby amwa ekom. And if you also na hono I say I say anka hono but na say ntokwa kitin bi abeda ho. No bo ha onufu na normal but let our na afi na anono atwekom. Yeah, instead anono be babo ntin bo na nkwa de na anono ekọ inside. Na bo o don saka pamotuma be feel say ebi wo ho. And a drab bebre wo ho. And I say you feel some lamps in your armpit. Na ebi so wo ho so abọ na afi onufu no ayekro. O de adro bia go so a enwu. Enti bibisa na me yehu. So these are some of the changes I'm talking about. So if you have the lamp, no, that is attached to the skin, now it's very hard. No, say a bit my breast cancer be. And I say if your nipple, no, first now I want thing, now for your rim. Yeah, inside a bit want to right inside. You have to know that it can be a breast cancer. Nah, a bit was what. But now we home kwan be na ne color no asesa. And I always say so here na amwakom because first na round and I say na hu na smooth baba here na fe atotom eti say bibi say no be so also here na moja efri anoba no one say be breast cancer ni bi enti see can main purpose of this talk is about screening. So we have to make sure that we are doing a screening and the gold standard is the mammogram. And your idea, I remember Ghana, I know I think won't even to say hand, they will take advantage and do it. And from fear bear the baby in fear than you to bear your son 9 ho baby. Or no, obey me up, and every it's recommended I'll do it every 2 years. We go how the breast the more do into me mammogram now, I'm on year into almost then your doctor will add ultrasound. And I say MRI to it. So if you have a dense breast, they have to do the ultrasound or the MRI so that they can see the structures very well. And the treatment, same-care treatment, most of the time the screening, when we do the screening, we see it earlier. That one, it can be treated because at times they can even take only a small part of your breast and your breast will be there. But that's when they have to take the whole breast. And they have to add the chemotherapy and radiotherapy, no? And depending on at times, we also have the hormones to it. So this is about the breast cancer. And I can say, a better lung cancer, but they have a memory in Banyina. And cancer, it's a second, if you take the breast cancer, it comes second to the breast cancer in females, but it kills more people than the breast cancer. So a cancer, a kuni papa, especially in the developed world. And you know, the baby say tobacco, say tobacco don't use what the possibility is obey cancer be a high. And I don't remember I could say you're shining so yeah, tophia. Your gas, your friend radon gas. You have to make sure say one man and for alcohol fear no. So that be a radon gas ni bini ho. Be wo and now continue if you are bet me am breast cancer ni bi. And you amom we adwuma wo uranium mines. Amom we atomic bomb ho adwuma nsa adwuma ni bi. Onu ye say adwuma ni bi bet me am breast bet me am lung cancer ni bi. And there is this thing they call asbestos. First, normal the year a dime pie, and today maybe more than 50 years. Some of them asbestos ni been And so yeah, was our factory no as best as I said, because we fear now, oh, maybe I'll bet me. And yes, lung cancer ni be. And on the screening, I must say, the main for this screening is the more about the screening. So we will be our George. Well, every day be on 1 pack. So for 20 years, and I say, on 2 packs a day for 10 years, you have to do the screening. And that one, they do a CT of the chest, low dose CT of the chest. So you do it every year so that a bit about swa umbehu na omaso anuntem ansana afa honam nyina. Enti another cancer so colorectal cancer another cancer yansuno. Enti ono si ade a yes screen wo ho nti na yeka ho asem so we so ye mba ne mba nyina. Se bia wa the ebetimi ehun ni say wow the ebetimi ehun ni say well na ukwa toilet na moja wom na so ukwa toilet na moja wom the ba pa ye hemorrhoids and to ukwa toilet moja wom che so will be but it can be another form of presentation to ukwa toilet moja wom you have to make sure say you go and check the colonoscopy Abu first ukwa toilet freely but after be 1 week cry now to be toilet. If you finish the toilet, also quite and to be busy, and you have to know, say, it can be from the colon cancer. A bit so amount so no a secret. And also the risk factors, and I said, then I also a more to me be so can also cry to me your chance of getting it in a little bit higher. And says George no dey say can George ne nsa no etimi ma sa cancer ne bi na you obi a on exercise ya obetimi anya sa cancer ne bi and yeah say your diabetes wo high wo obi a betimi amonya sa cancer ne bi e friend no ulcerative colitis and say Crohn's disease was higher ni bia e betimi amosa enya sa yare ni bi na sa yare say yeah before dose pan we mu na abusuam so asem cancer most cancers na runs the family so hanas o nya bia na say o ma mi ana so obi nya bia you have to make sure say we are going to check yourself because last month I met a patient on only nya na nya bi keke no they are in their 40s. And also check no anya bi enti ade a also everyone will abusuam enti e be na screening for this type of cancer enti yeah the gold standard no your friend colonoscopy no okwa no the camera bi ahye oto honom de akohwe onsunim enti most of the time, what so they see is something like they call polyps. It's some small growths. So start as an starting. Be a normal the collab. Some the collab no more sure say normal and say cancer woman. If it's cancerous, then they have to do further tests. Now they have to do surgery. And normally, this colonoscopy started would be 50 to 75 and now say ba we obi a bi ewo obusuam yeah you have to start early at least if you can start the screening about 10 years before that family member got it so be on your 45 you have to start the colonoscopy from maybe about 35 years now Nancy has to be about or a friend of Cologard I am advert on TV so that Cologard no it just detect I say we jana no mo fa bi no the color akohwe say cancer cells need be woman or no it's recommended for people who are young maybe less than 50 you are low risk you are not a high risk And to know ye bia every 3 years bia no, you have to repeat it. But I not say I'm gonna say positive cancer cells in bone, you have to go and do colonoscopy. And yes, I said if your family member has gotten the disease, you have to start screening very early. Because if you got it maybe around 40 years, I have to start screening from about 30 years. Because it runs in families. And yeah, where for you, that's a picture. It shows the So this is your intestine, and that's on snow. Obi on snow on snow ketwa na on snow kese. Nti the can most of the time cancer na affect on snow kese no. Nti omo ye colonoscopy down snow kese na omo hwe omo timi nkwa nketwa ne de emususu anti omo timi nkwa nti. When I make a polyps no na say growth a woman nti omo a initial na nkitin na enyi ye kese nti wanya ho hwe afa na be kese abe cancer nti omo ne nkitin we mu na omo timete na omo de kọ lab omo se cancer omo afa omo betimi ebi etwa ha ne firi ho se de be ya enkoso enhaw nti treatment that time treatment most of the time we are talking about the screening. If you screen is seen early so the be ya encourage na how be brain nti you hu ne ntama omo betimi etwa omtimi try yare nya kwampa free ho a unhia dro bia but omutwa na so mo say bia ano na bi wo ho a then they have to give you the cancer dro no and radiation no. Yeah, because cancer dro no so a eden kakra nti so obetimi hu ntem na omaso ano amawa na eye I think say yaka ma no die ho bebre nti ebeka ba ku bi afa mema ne die ho na afei yedi yensemfo na ba wiye na afei questions no na afei about 4 panelists. I think say questions na baby nyoma bebre ni ache enti mema yare a cancer obetimi screening ho ye frɛ no prostate cancer. Yeah, prostate na ade bia it's just under the bladder and I say just ojon se twa no ano ayese ebia ne kase ti se be nutmeg ena hye ho then so ade a ha mmema ne pa se wonya prostate cancer kra obenya kase na fe ama obibi e frɛ no BPH and I say prostate prostate hyperplasia benign prostatic hyperplasia nti yeah ade mbema nyina na nya do 50 kwa wanya prostate cancer ni bia obenya benign prostatic hyperplasia ni bi na cancer we cancer mbema pa ye but odi by baby to say baby away there is the second cause of cancer deaths in men. Every time the lung cancer is the first. The lung cancer is the second cancers in men, but it's the first cancer deaths, first cancer deaths in men. But prostate cancer is the most common, but it's the second to the lung cancer. And normally, very common in men 65 to 70. From February do some num kosi eduoson baye 9 ho baby a ade a etimi how and them say can be for the way so bebre yeah and say na etie ne picture no and we no ya jonso twa baby a jonso ebegina no it's called the bladder na prostate no ewo ano kakra nti ojonso na ba edika for prostate nim nti sanya cancer ne kra be ma bi 50 na start ye kese na esiwe nti etimi siwe kra time baby ojonso fa no ojonso kra nyi esi akosha rubber nti na muti se mema ya shom rubber na prostate na man yesa because ye kese na esi baby ojonso fa no na me akosha rubber and I say they will give you a catheter Yes, so but this picture is for prostate cancer. Say cancer be started so nti ehun ne ketwa say ya oyetimi ya hu bibi enha but to twan ma ne koye kese this picture wa last one ni dia o de na afa ho nyina ye ya ho nyoma na na anu ayedin ye enye na do beko asamado screening, something can all these things about screening so that we know when to screen and so that we'll see it in the earlier stages and able to treat it. There is something we call PSA, and that's prostate specific antigen. Obetimi ayo no kwa afibia and that's omo we want for digital rectal examination. No call doctor the special to na what was special to obetimi Philip prostate no one who say kese and I say I den and I say with me feel it a dribble or home. So the digital rectal examination that will let the doctor know you can do both or you can decide to do the prostate specific antigen or PSA, and that is the most common one. Do it yearly, and as you start from 45 to 75 years. If you do it every year, when you get 75, you can stop because 75. If you get prostate cancer around 75, something else may kill you before the prostate cancer kills you. So it may not be necessary again. But only 75 now. So I hope on who the obet me akoso. Same and the symptoms similar to the BPH same sika na say ko eche dia timi odonso timi moja eba odonso nim says baby awon so etimi o eba matimi ahojojo matimi ado blanda and I say cause erectile dysfunction this one also gives the urinary retention just like the BPH and prostatic hypertrophy. And say echena say was severe low back pain. That my organ that's how people present with Ghana because people don't screen. So somebody will come to you and say, me chia me yapa mintimi enye. At times it's able to infiltrate the place. It even makes you paralyzed. So yeah, as I said, it's a screening so that it's seen early and it can be solved. Say, depending on age, they can always be watching you to see if it will get better. As I said, if you get about 75 years now, they may not do surgery. They will watch you to see if it's getting bigger before they do surgery. And I say, prostate in every hole. And I say, treatment, radiation to cure the cancer. But no, most of the time, same thing say will be big to be an TBS about money found one day and just after aka say be ma unjo because be bien who kwa cancer na fi because afa ho nam nyina enti me de me nsem fu ansa me kasa ye ba wiye de betimi e de aboye ntoma no e de akofie ene say so me de me kasa no me frame me kasa fu anan me kaye no yearly physicals no is extremely important because on the bet me hu there will be to chima na yaso ano from your head to your toe because one you no dia otina hwa na bibi abebo mu na edoko nti wo call no dia unni primary care you have to try and go every year and do it. Some people it's every 6 months, but at least every year they should go. So only primary care, you have to make sure you are going for an urgent care every year. Be able to check your labs for that. They'll do exam because of physicals to check everything. They'll do it for you to make sure you are good. And you're doing the no. And so and who here say it can be say when in the year and we do second now to amfa nto aduane pe a wo nyina wo de waduro bɛyɛ w'aduane enti ɛwɔ sɛ yɛdi aduane ye I mean yɛ aduane no mostly carbohydrates enti yɛ carbohydrate wodi ne sesei no I mean there's no formula but wopa wobɛkyɛ w'aduane mu half fufu a wodi no sɛ ntoa mmienu a afei ntoa baako no wobɛdi baako na baako na aka no wode ayɛ ayi nko a vegetables nko a salad mo ne cabbage mo ne broccoli mo ne no do no I half enti ɔsɛ yɛhwɛ ne yɛ didi ye ɛna sɛ yɛsoso a ɔsɛ yɛhwɛ sɛ yɛbi ɛso ate kakra because kɛseɛ no so etimi ma yɛyare bebree and it's easier said than done. It's very easy to say lose weight. It's extremely difficult for one to lose weight. But now, I mean, Sandro drone biaba or them picnic sanko omundrom can but a draw status out no more. It's like having a blood pressure and I said diabetes. You take it for life. And but also to party also to a so pana. We exercise at least in a week. You have to do at least about 300 minutes of exercise. I would do something can also take carbon so now the about half no vegetables also half. Be an exercise there cannot be something can person also tell we also we exercise at least by 30 minutes in a week. But exercise can keep between a bia no at least put me 30 minutes a day and I say if 30 minutes no and you say and say maybe one time o between a bia 10 minutes in a day or no so 10 minutes when you adage 10 minutes when you adage because you be no time 30 minutes say or the exercise no because come your adwuma no e ma yakwa me anya hwe but when you be 10 minutes between the exercise break time. Not the exercise. Another time the exercise. Another time the exercise. 30 minutes in a day is not bad. And I make an say in San first, so and also but to say no don't man my own crown bet me a haunty. So bet me a jai cry. I want to mean jai nasa and there was all test of crown to it to be. And that's a great and cigarette there. I mean I'm Ghana for endorse for you. And you know, be there. Make sure say a jai because cigarette does cut out what you're now to a man. And I'm some kind of cancer and some baby. You have to make sure say wage I want what cancer screening, breast cancer, cervical cancer, any colon cancer, any cigarette and lung cancer and so on. Yeah, and then drone no so you make sure say you do my no ni anum ni ye your Ghana bi obi to call he say mama yi mama ko am for call me no na me nkonom antibiotics so there you dey be 5 days 7 days you also anum ni nyina eni so ka say me ho atomi enti me janum and I say blood pressure drone or so no de bia or diabetes drone so no de bia and can say na there me feel bad into me no because I area no feel bad be feel bad and ma other say stroke and I say baby sir heart attack and be sir until drone the only one a control say area no and conforce be ka say bi omo draw esa and draw bi no ho a etimi sa area no also so ano. So to me, say the bit me has also na so tia say aren't me echo. But say yes, I say draw be a more drone take up there. Maybe say anyhow. Now you have to take our mental health so very seriously. Because and paper you say bia you was can I say you are brochure and be santi. Mental health ain't me high. Mental health and found baby I was sick baby I want to here and say then. So like hard doing. Nti wo ho na afi won se bibi ansi bon so ra ho a wo ye ho hwe nye ye o fe won timi ni wadan fofo ndi agro the first one ni je ho afi won nya bio afi de bia wo ho a bibi yo se o so cool ho na wo ra ho wo ye nipa boni ni sa wo se bi sa ba so ko hospital ntem je se wo hia mboa won ti se bi wo so afi bibi ansi kwa wo se wo de bia wo yam hihye wo now like BBS is all to show BBC to also hospital now you because be a mental health na almost on because also ko etira also dey wo enenam and ade ba ko Ghana for so yanya ade ne say yakọ hospital awa ha na ye ye call ya na to obudin doctor no whatever he says no na yakata ya no yakata ya musa bibia and your hospital we have to make sure say we are asking questions to really understand whatever is being done and let them explain it to someone take they can come to your level. They can get someone who speaks Tree to speak to you, and another who speaks Ewe, and another who speaks any of the Ghanaian for any of the Ghanaian languages, for them to speak to you. So you're quite saying some you can because hospital no so lots of mistakes happen in the hospital if you don't ask questions. So that be or be emfa or sika enkojananka. Enti me did say me the man besia na ya no question time na a panelist no omunya beboa me na ye nsamfo na no enti me da mase pa.
Thank you so much, Dr. Barima Poku. We really appreciate this great presentation. From now, we're going to start with a question and answer without much ado. I'm also going to be monitoring the chat if anyone has a question that they put there, but if anyone is ready, the floor is open, please. Time for questions or comments, please.
Dr. Marie, I have a question. This is Cynthia.
Go ahead.
I have a question about secondhand smoking. If you are exposed to secondhand smoking, the long-term round effects of secondhand smoking.
Come here, program.
Your question, you're asking what are the long-term effects of secondhand smoking?
Yes, to someone. Like if you are around somebody that smokes a lot, or like if you are in an environment that somebody smokes and you are exposed to it, long-term effects on you.
Okay, thank you. So as far as I know, secondhand smoking can also cause lung cancer. And that goes for even if someone smokes outside and they say, oh, I even smoke outside before I come in, I don't smoke in the house. Smoke carries in the clothes and everything. So it's not just the fact that they're smoking even around you. But secondhand smoke does cause a lot of lung cancer, as far as I know, yes.
Thank you kindly.
Yeah. Any questions?
For the questions, so Trini, Casabia or Tibio, Casabia Cotibiano, okay, you're wrong. On the church, me and to cry.
Tell me what question?
Yeah.
Go ahead.
My question is so obi smoky. I said ni pano ebiana oko smoky ewo me fa no say oko share adware no wa lucky. No wa smoky wie. Na mpacho pia abonti betra on chen a. Ono so obetimi anya infection na. Mpacho my question am. Wa ko smoke wie e no aba betra.
Okay. And he said, of course, smoky. Most of the time, I mean, say, a idea, or smoke goes what, but what course smoke with the the effect may not be that much because it's not quite bontino. And that's what coach baby, no, but say Bianca only know about from one and call smoky there. That one there, the effect is big. But what course smoke we know about on chain, most of the time, the effect is very small. And when they ain't hard sir. And I mean, it's advisable say only the power of fear now so smoky or so quite bonting. Now go smoky, we are not for what Benny pan in chain. They had a son on me, especially one Korean man. If we advise them say they should go out and smoke. We are not a beefy because I mean no small or sort of and yes, sir. Oh, never been to okay.
Any other questions? Comments?
Hello.
Hi.
Hi.
Good. My question is, say it's here, doctor, the cancer, you know, what you mean, be no. I think enema mienu run through all the cancers. Enema mienu bit make I say your lifestyle. And I did yari be breathing in my name because or cancer be no smoke and alcohol. Or cancer be the causes of no smoke and alcohol, which means our lifestyle no contribute to the greater portion of sicknesses and illness or any podium. And a program when see a Christopher Roman phone in any Asia. Our line we see answer. We rumors on them when you the kind of to the beer doctor and young crowd just a medical team for who Anthony. But Tony, but who sister no kasa no Dr. Poku. Yenya Catholics and yenya so yes answer your medical field. On the summary, what kind of advice will you provide in respect of our lifestyle? Oh, yenya yaso in mune in fancy ni pedua in general.
In the 25.
Oh, Doctor said, and now Udo Casabe,
Aye.
and I answer the Mr. Anobisano, Udo Casabe, opening in that offer, a dear Obia here say oil, and now boss, okay, say, or Safi Bia, ye boy through for say, you better Doctor Ho, I may check him out, and yes, so you don't also call Doctor Wafino, I finish one, we are real, when you are also Doctor Ho, not you moja, and the moon of who you are, dear be a woman. And Dr. Barima Saka said, or say a tree did ye, or say, they be a free by a dreading in a body by and more, say your name in start the woman, and why a body of your mammy will say, and why away a new community. Say, Cabaya, but Dr. Barima said, Ubet on Cassette, Dr. Nodi, Jai Moody, Jabay, Dosinemo, Ubedia. Dia nanka wodi ne bebe chem na mom dia aka no fa ye nwura aduane salad ne broccoli ne sa no na carrot ne dia no fa sha na se be ya aduane emo ne abodie ne bayire ne banku no enko doso na osa ka se ye pese enya pomdie ne yetimi cha o se bomodin se ye be ye exercise o ka se ehun hia se o ka se bia okoshe gym 1 hour for exercise there be o se de bi otimi 30 minutes otimi enante efa potem otimi walk ekoba saa 15 minutes now sa bana enu sa kwa ibi kan wa 15 minutes wanya 30 minutes na wie o so yes ebe boa ma omoja anante ya ma kuma ne so akoye o se ye me duru a ukoda doctor kasa o de duru ya mawa me ensam be fie enkuti chamanfo ano enkase ma mu enu we se eye se ntimi mennom o se da bi o the doctor de drama say wo ya de waste na also no ma de bi anom sa sense wo be ja to aka say o twa e da bi e da o ho ton no akono say da o ho ton e bi na ya da bone enti ono stress say doctor do ato dro bi so a sitiate amanfo ano bibi ha wo dro no bisa doctor ne mum esense we bisa amanfo a omo awante no no obi di atoto so bia ne de obi dro anje ne bia wo de anje nti o so ne doctor ne bi ko se bia ho a it was say colonoscopy
about
we
prostate
so ye bia
cancer.
ko ye bi we oba mammogram umra so ko ya oso ko ye bi pap smear ni nyina oso ko me check ko no mo nyina ya check ne se o se edidem mu a ye be so na ye di eti bia obodo tofa de obedwe no nsem nyina no se romafo ye pese nyiri chire ti biso nyame ye no o se so nya apomden no bobo so nyina kire no enti de hia pa nde emse afi bia obetimi a ko doctor ho na doctor ntwu moja efise moja ndo bo hu se bibi tuchi ma ne se bibi nkoye enti na de metifri Dr. Barima wa metimi abodo tofa ma no na me de bibi ka ho Dr. Barima kasa ya no ade ba ku bi so ho na cancer bobo ni nyina no ba ku bi ade bi so ho se hwe se wote wona se ebia se de Dr. Barima tufu se ti odia ne die so na di nwura sha na ebeto abo ma so ate onya bibi sere se oso ete prekopa ya ade o se o mane hawe oso ete prekopa ya ade a na free cancer so ka ho bi obu cancer bu wa be ye wa e ma so te it is what one say wan kasa nko no Mozambique ongo opa na bia so so betera wan kasa wotu onye hwe edwane wudi ada odina fe so ate amna munum wo sa na dia o se o mane how na akọ doctor o kase na nsɛn mu busum miɛnsa na yi me so ate se hwim onti ase bibi sa ba wa o se o mane how na akọ doctor o fi se eduka se o so etibete amna munum sa wo kura wan kasa onye hwe emfa ho na da no so no mo be doctor be kasa wo cancer wo hospital wonum mpese me de ka doctor Barima ka fa breast cancer no say obi bisa the question say o ha e normal say enuf enso be fu nufu ma ba na no so uni ba unwo ye na say uni nufu a odi ma akora dia na say wanyini ana say manufu na say enufu enso afiri onufu ni dia enya dia ya ne mo se fu
No, the step.
na say eye enia ese moja na say wo so hwehwe mo nufu na say asa bibia abodua ana say toa bi demu a oso de oso pre won tentem e ko doctor o say teriyo say free ade ne fu nufu ba ko pemu na eba na do say fon say asa bibia hunu mo na say de afiri mu ba no eye moja o say ana ta ben cancer nti bibisa ba men tra fie nka say enye hwe na fini mem na eba de o say ana ntanye hu baba ko mu die ebasa to become general doctor no enya so da sonti doctor na sonti do hu efuto we to the amount kakra mpesem de kadia Dr. Barima kai no
So much. Any other questions, please?
Dr. Patromi Wasembusa.
Please go ahead.
Okay, Madam Wasi. Me person me say Dr. Barima Castano. No, kase ensa enye ebiema ye mema. Na person me who say ensa no alcohol no ebia the end results no equals a sugar and a baby sugar sugar no and a manine into a basana soda so no enom and also entimi and my cancer. If it's a soda no so end results no see sugar into patron person who so that sugar any never liquor and alcohol effect a edema that's
Dr. Azera, you want to take this one? If you're on the line.
Yeah, I'm here.
Thank you.
All right. Into that, Niana, Dr. Barima Ekano, alcohol no, to say Nia, what can I say sugar woman no, and yet sugar and quana, a war alcohol mo, or more other chemicals, or more mix it together to get fermented taste na yeah, and that gives them the high when it comes to alcohol. Into Sandra Manamana, a cause cancer no. Nia woka say soda no and there will be a friend a high fructose corn syrup a chemical eta wo soda mu and also bibi to say Ghana for your new tin tomatoes those are some of the chemicals that are in soda a cause like I said diabetes and no and you said necessarily said sugar don't want a war alcohol no. Remember, this baby to say gin, it's not sweet. Baby to say brandy, and also it's not necessarily sweet. So other chemicals too. It's a composition, no omode drink no. Into Sandra eventually no. So it goes through the digestive system. It ends up leading to cancer no.
Thank you so much.
Yo, Dr. Maureen Patrick, my question.
Please go ahead.
My question is, what are the symptoms of menopause, and is there any medication for menopause?
I can take this one.
Go ahead, my dear.
So menopause, I mean, there's multiple symptoms, and I always say this: every woman experiences menopause differently. The number one thing is the hot flashes people get. Another symptom here, during sexual intercourse, people have like dryness in the vaginal area. in terms of medication for menopause, no, yeah, we treat more of the symptoms that you get. So there's really no specific medication I work. So for example, we advise patients that during sexual intercourse, people use like lubricants to make it more comfortable for them. In terms of the hot flashes, and I know obviously it depends. OBGYN, some people do like estrogen therapy. There's other medications, they are called SSRIs. We use it, it's like a type of antipsychotic. Some people also benefit from that. So it's menopause. Now, yeah, it treats symptoms, no, and yet say a draw specific. There's other herbal medications too that some people use. An example is, I mean, in South America, Formuta uses something called black cohort, and also another medication a young couple use to treat almost symptoms of ammonia with menopause.
Thank you so much.
Thank you.
Any other questions, please?
We have some question on the chat, so if you guys want to take a look at that too.
Take a quick look. Okay. There's a question that says, what really causes cancer?
Okay. So what really causes cancer? And it's that one is very big. So what causes cancer? Mainly say Obiano, you have cells. So the cells, once they grow, then they die, then new ones form. Once they grow, then they die, then new ones form. But there are some conditions they continue to grow. They don't die. That's what causes cancer. And there are some chemicals that is able to change the composition of the cells. Once they change the composition of the cells, they make them live forever. They don't die. Like, that's what I'm saying. Something like the smoking and tobacco, and they're able to change some of the composition of your cells, so that they continue to grow. They change the DNA of the cells so that they are printed now to only grow and not to die. So in a nutshell, I think I would say something like that because it's very broad. I mean, you go to apoptosis, a whole lot of things, but I think in a nutshell, that's what happens. They change because DNA they determine how the cells will function. So if the DNA is changed in such a way that the cells just grow and they never die, then if now cells now from grows, it causes cancer in your system. And that's one explanation. I don't know if anybody has any other explanation.
I know that cancer in general is multifactorial, and depending on what type of illness sometimes runs in family, which unfortunately we're not always privy to a family tree to say that maybe someone died in the past or a great-grandparent died of such illness or such illness. As far as I know, when I was in Africa, most of the time, but I know that that's not an actual illness, an actual cause of anything, right? So when we came to America, we realized that maybe some of the complaints that they were having before they died might have pointed maybe to cancer. But I know that certain cancers run in family. That's why, for the most part, when we do the screening, we always ask you, is there any cancer that runs in your family? And how old was the person when they had the cancer, was diagnosed with cancer? And that usually would give guidelines on when you should start we should start screening for the cancer in general, but it's multifactorial. So it's hard to pinpoint a specific cause of cancer in general. But as far as I know, the only cancer that has a vaccine, I would say, is the HPV. So, and whenever you, we do the Gardasil vaccine, and we give it to young kids as young as 9 to 10 to prevent HPV and all that stuff. So that's the only one that has a vaccine, but most people don't always want to take it, but it's recommended for kids as young as 9, 10 years old. I'll go to the next question in the chat. It says, please, my question is, can African medicine cure prostate cancer?
Yeah, Tony, where we are now, say.
Dr. Kose, Africa medicine, you know. Yeah, question we say, question I won't even answer. Right answer, that's a wrong answer because say Africa doctor will say what timaki or be cancer. Just say proof. But when they say you want your chromona, a doctor for the say omoto to say you war educid bebrea, almost say omodro, because omodro it be to HIV flu. And so munya obronika se bibi cure. And yes, what I'm like, what the why edia ama obia or the man and ama on the corner enya na yare sama otimi di adanse se na me ti say sisi ma be say ba ye krom no ye nya bibia o se otimi ye test ye lab work e ka se sa e normal na ekoso wo widie mu na ese bibi no sisi unumu doctor we say duro no ye ko check ye bi ni wo bi ye krom ka ne sa keke omu nko ye bibi mi ye mfa hu nka anka ma ye bibi na ma publish about bontam ye hu se e bia kwa me say bi ba ho no na me say cancer e wo me cancer wo mechi papa wa medro amanako efise ahase se cancer wo kase mu a enya wo kase mu ke twi moja ye behu bibi wo moja be se cancer wo enti osanka yes yo kromfo no omuti bitwi bibi me yenko cheke mu se ampa e wo ma na se ni ba bibi se ni wono omodo wanu na aka ne sa se masane yade e na ma ana yentimi enka se e de kroto do se ampa eduro ho na se eduro no ebetima be se eduro ho eduro de bibi ho no bibi se eduro a amrafuri ye nyina no efiri ahababamu eni nduamu na omusua firi mu eti edro ho na se ebetimi atwe kompa ka se odro we say esa we cancer de because ebetimi aka de na me yetrofo me hu bi na mintimi di ho adanse ba oboni de me hu bi ebize odaya me hu e de abagira me yatwemoja akohwe hu se bibie ni eti ebetimi si se ye odro Africa odro ebetimi asawo yade but me hu bi da mintimi ka se no kra na se nya no kra doctor.
Thank you so much. The next question on the chat says, could you please give more opinion on Ozempic and Wegovy if you're only pre-diabetic? I think I can take that one. So the FDA, which is the Federal Drug Administration, is the organization that usually approves medication for use in the United States. So far as I know, Ozempic is approved for treatment of diabetes, type 2 diabetes. And Wegovy is approved for management of weight if someone is obese or overweight from adolescent to adulthood, and also approved for treatment also of diabetes type 2. So they're both part of a medication class called GLP-1. And so far, it's available only by injection that people take once every 7 days. So because it's approved for weight management, like the Wegovy, doesn't necessarily mean that your insurance will approve for you to get it if you're overweight or you're obese. So you might end up having to pay for it. Some doctors, some primary medical doctors, if you go regularly, you do your checkup and you're pre-diabetic, meaning they check what's called hemoglobin A1C. And then the number will say, okay, you have about 5.8 and up. Or if your fasting blood glucose, meaning sebia, and then when did you cry, and then they check the blood sugar and it's 126 and more now, you qualify to be called a pre-diabetic. So at that point, you qualify to receive Wegovy as compared to Ozempic, which is for people that have diabetes only. But that necessarily doesn't mean that your insurance will pay for it. So you might have to pay something out of pocket. But the companies usually have coupons on their website through the manufacturer that can make you pay sometimes half. I've seen people that have prescribed with and pay as low as $75 a month, but that's because you have a prescription, and then you can also use like some prescription assistance program through the pharmacies and stuff. But as far as I know, if you're pre-diabetic, you can get Wegovy. You can be prescribed Wegovy, and it's usually one injection once a week. In addition to a physical exercise and reduced calorie, like Dr. Barima said earlier, reduced calorie diets. So it's not just by itself. If anyone else has anything to add.
Yeah, I think you said mostly it all, but as I said in the speech, if you are taking these medications, you take it for if you are taking the Wegovy for weight loss now, you take it for life. And it's also very expensive. Yeah, it's not something that you start and you stop, because for weight loss, no, once you stop the medicine, you are going to get your weight back. So it's something that you take it for life. It's not something you think I'm going to take it for a few days, a few months. Now weight loss, no, you take it for forever.
Now, on the corner beside, no, I'll come for just purely pre-diabetic and let's say your obese account. If it's all your pre-diabetic insurance, woman cover because won't cover for that. Or be not even amount for that. Just pre-diabetic now on your obesity. Dr. Pokrabo and prescribe because you don't qualify for that. Say be away your obese and all what that comorbidity be. Why ya sell person so to that encore dia. And the doctor debate to consider and omuka by still no way to be because omo pre-diabetic omo you very straightforward on that say unqualified. Yeah, I don't know ya more you full blood diabetic and I get the moment I say omo person will see weight abeti. I may do not the same answer my kayade. It will just purely pre-diabetic. Now when you're obese and as only other commodities be a cause problem untima or sontia. Me just say insurance be a back of armor and no just a prepare so bit bit you sick idea and be a doctor the better so I prescribe one mouth.
Thank you so much. The next question on the chat, is there any question? Anyone wants to ask a question?
Yeah, can I ask a question?
Of course, go ahead.
Doctor, if I say me business Dedi kai, ye ni ani ye di no ka ho asem bebre. Ye ni e wala isu na asorefo. Ehwemu bia duani pie wase. Spices bay and a queer duani mu a. En moyen. Ubetimi akire me mu.
Okay, maybe I medical efrasi and maybe I when a man be mbetimi aka ne kese. So spice pa the enya kra the the aduane organ bebre the Maggie cubes no. Aha, so Maggie cubes ni the and the
That was a doctor maybe.
enya kra.
Why you are not?
If you aduane mo e babua, ono the ade ayakoma yare e pray papa.
Me.
And you know, if you have more, and I did say, man, to us, omo ye aduane ye. Yanu de say, omo ye ni edi. Yes, we have there, they don't make good man edi.
Yeah, spices ni bebre no, like maybe say nutmeg, adobo, bebre na in chini wom on Americano. So it's at the end of the day in China, say we know the one of the biggest thing, high blood pressure. Inti I say we say spicy aduane. There's other ways I obetimi use, obetimi mix it tomatoes, maybe mokoka kra, now the ginger kakra, those kind of things. But I need dear say Maggie, either Maggie or adobo, nutmeg, or would the great aduane and chin in the end they wumpa.
Number wine so alcohol more can was him. Now dog dry wine so say it be a week be obedi di opese wanimu timao. No when you dry wine no tabe a quarter of a glass bisa it's saying
Say can insanity first near Jessica say no so embo. But I say yes no as I monocle cross as hard dream be. Yeah, over to me a jack cry, yeah, bound to me, Jana say, what the phone him kakra the apple diet on the hard.
Yeah, what did you want to now pugu? Said you
I thought what they fall died. Oh, can you tell me the hard but over to me a jack cry,
In the first, now almost cause a red wine and white wine, or be able to say red wine is better patch and so and no correct.
Sure, who say no correct? Dog. Me pesa o katre me ku penny ni say me sreno si di Christian Mothers Week ya talk say yabane enye be mienu I suppose a futusem Bible asem topic say yabane 2 times in the week I suppose futusem Barbara sem me kwa me suggestion no.
Yeah. I think that you all kind of won't because I said, you could hear Bible asem. Enti, when in your dear tighty, enti, a enemy no, and you won't be a sick asem. And so, no, well, next time you the car where, not Bible nearby could be pa. We be saying you sick asem, and they say, we say, I say sick asem ye. Insurance issues, I think, sir. Na because say be ko tie Bible asem ti ati say pani wo kan mo so wa fa ni pen na wo tro ento o de atu ni ko to dwem
Pacho, Doc, me so no question.
Please go ahead. Thank you.
Me Pacho say, me fan say, Oba, ye you are wodia, utuminya cancer.
say ye you are wo dia I mean say minim de ente ye you are wo dia no na ebia wo cancer na yi ana say ye yi ndada
Me fan say bia fibroid.
okay
No mu yi ni nyina.
Yeah Ghana for because of fabulous enti oh no ye I mean most of the time we mo ja beauty say we wo ovary wo enti obetimi anya cancer of the ovary so also I ja ovary no but when you there you ovary nyina because say no unhia ovary ni fanya we do menopause I for ovary ni nya hwe ba nya ndro menopause e ja ovary no na so nya no ne ja ovary no ayi wo ma ovary no wo ma na say be to kotua no wo ma ono betimi am cancer later but I mean kasi na we ye free ho I think say make us and them say the my cancer pa ye service no and that's how they na no to you on free ho I think say that's a chunk of what can cause you cancer but you still bet me anya bi ovary no mbeja wo ho no bet me am obi but what do man put down we ni ni ade say wa wo de ni de ho de ye bibi free ho na on cancer no
Say we kosua na wo kan na che say ye ja ono obetumi ebu nsa no ana umbu nsa no.
Ono ema onya menopause. See you ovary ni nyina free ho na so onya ndro men wo 20 years cry you ovary ni nyina be mo onya menopause.
Okay.
Ono say bent say ma onya ko na de ma oba ohun sisi ho so no ye ovary no. Enti you free afi na ohun sisi ho so abio.
Enti say me pacho nya say me bisa bebre say oko hospital na say ba ne sa na me fan say so mu yi ni nyina na omo bo wa amane so ebia e pese yi ni nyina enti yi ni nyina no ometumi yi na omo eja kosua na na so omo be yi ni nyina ne kosua na wo kan no
and me ka say jan onfie kra wo so ina jan me bia are no wo say wo menopause o mbedi no ombe no mo ja kosua no ho but so what menopause o mbe ye kosua ni nyina na ade ba ko a me kan say wo hospital so obusa and say so tan ka say ya o so obusa mu ye say de na mo ye ama me mo yi kosua ni nyina na say mo de mo je bi wo mu enti mo ka say be je bi wo no say dachi be bia kosua so betima more problems but yi ni nyina don say ho de na say ho I free
okay pacho me that's it.
Thank you so much. I'm just going to go through a few questions from the chat. There are a lot of supplements / vitamins in stores these days. Are there any recommendations for vitamins or supplements?
Yeah, me Tony last time I can the Bam Hospital baby.
Turmeric as vitamins and I'm not going to read something on BBC. I don't be say are they worth taking supplements. I didn't say in Calvert media aduane na obedi no de obenye film na nkaye papa na o doctor nka kire ese me am kohwe insurance ba me kohwe amanfo mu fi obekọ na o kasa kototo vitamin B12 vitamin D calcium magnesium zinc just one tis obi nu bi no akoto bi e ba san de enkoyi o se o ma entina doctor Barima ka se o ko de twi moja se bibi etosi ni o moja mu a doctor ne be ka kire say ade we say to sinti me ma ana se wakọ yi over the counter koto bi de shasia no na wanga se memfa wo pe enkoto to se mu ko bi fi no ono kasa kota potassium eno onum ade wo so bi ka chere say otanya cramps into no potassium be man nano mu ya ne energy and am see dey bi ubetime heart attack if it's a doctor and can say potassium e wo low adentre wa akasa do pekoto potassium eno it is a supplement no dia mesusu say ubetime doctor di nkomo abeboa if it's a supplement nya na unhie bi wa umoja no wo bro so dada saa de na ukoto anu no wo moja ma unhie bi ba ukoto enuma na ama na bro so vitamin D ni calcium ka say yi bro so ni nyina so wo supplement ni nyina bro so a ni nyina so de side effect be sade abrewo saa vitamins na wo ni nyina bro so a de be haw no anhwe ko betime ku etimi de wo store omoton omo ya advert say yes but enye ni nyina na je enti memfa wankasa wo pe enkototo enguo se onum efise obi aka se onum bia ye se anka me de wetu se onu doctor bi di nkomo na doctor ka se ebia otwi moja no vitamin D e low nti koto binum o calcium be low o magnesium be low a on ka sa ankyere wa memfa wo pe enkototo bebre enguo se wankasa onum saro na say 50 last year onum bia wo store akwa na from fan turmeric yeah e good onuma e good but dear me hu yam say na by hospital wono omu nyina omanu no monya liver disease ba ne antiase doctor no hwe mu say ade yakase bia onfa tablet ba ko a ono ko na de pe no afa ne bebre ono anum ne de opa bia hanti wono ma de pro so a eno so ekokọ so omu monya liver disease inti supplement ni nyina no me emfa ye pe enkototo en no sa anase what is say obi no bintu so koto bia no de bi edu na ko no doctor bi ne ka kire no enti me emfa ye pe entoto no sa kakra metima ka fa ho
no.
Thank you.
Doc, mate, my busa bibi kakra.
Please go ahead.
Doc, promo na ye hu na sa profo no. Ase omu hu se omu abusuafo bi enya sebe breast cancer. Eduru me bi a no omu akọ na yi omu no fo no eyi no afiri mu ama omu. Ma wo se tuntumfo na de ye nta anya sa de no. Minim obi a onua ma mienu nya bi. Wama hwere wama nkwa ntimi di tunefo minim se ne kwan so a o cheke de ba me tunefo so gidi so wo wi a o ye better of so obeyi go unu ama mienu anya bia je se wo se wo se wo mojanim nti ma advice amene me odo menya medical for ba de ma advice wo cheke no office wa wi na se wo yi free mu a how ben about so so akoye free mu ma wo like bibia na mpacho.
You start Bridget befa we are.
But you just to clarify, what omuya? Do you mean obviously now can't breast tissue no?
Breast tissue.
Inti ni awuka no correct because omu will be omu friend BRCA1 and BRCA2 gene. I say a mutation it's common in mostly Caucasians. So most people know omu koye sadien because obi wo ha tested that inti onim say maybe that mutation runs in the family. Inti oyi tissue because cancer na it actually affects the breast tissue. Into oyi omu friend prophylactic, right? Treatment. Prophylactic is you are trying to prevent it from happening in the future. Inti I don't know yeah, blacks no. In terms of genetic mutation, you know, Ghana, it's not common. And you be I say obi sorry no I say me test it. Marie Kaya at some point say yeah ba hanane who say some of the symptoms are yeah mama and papa had in the past no. You notice probably it was due to some sort of cancer, but because I not yeah and test we tend not to do those things. But see, I have a more developed country, no. Let's assume say, first degree relative. To say your parent, a brother or a sister. If say I didn't so as in you have multiple family members that are getting that particular kind of cancer, I would say it's worth it with these things, especially with prophylactic either obey breast tissue now say some people will probably take out their ovaries, but you also have to remember maybe to say ovaries say we are obviously we are younger woman, you can always go through premature, right? You'll go through premature menopause. I don't know if anyone has anything else to add.
I think you said it also. It's also kind. I mean, Peter, all kinds of one. I mean, so they all have to go so in that case they have to go to hospital or had me BRCA 1 no BRCA 2 no. Ghana na be a bad thing, but Ghana go was come to me that South Africa yama. And to also quiet because BRCA 1 and BRCA 2 you will be about me say be bayo. What won't he? Oh no, also call you breast in term crans and a bio. And but said that Bridget A a wire so sir, or a broken the woman, but wow, sister me no any be say, oh no, it's possible so was I any be air high. To cause from check, you check that say also then the advice you have to take your breast. Breast should we are BB and Daniel. I just call you over no. Breast in there, I mean, life, keke, and debo.
The doctor any effect for Bema so
Bema, there be Emma effect be a so Banaquina effect of Bema so. Oh, say,
no children.
And you read only be known there, but hard sir.
Doctor, I'm moving to me the silicone share, so that's another.
Thank you so much.
Doctor Mpacho mbese mbusa question kakra.
Go ahead.
Mpacho wo. So you obi a o soli anopa na untimi ndidi a so un obi a upa anopa aduane di a na odidi fiti bi a be 2 and 3 day kwa ubetimi enya symptoms bi ana. And my second question so mate say yesu wudi kan mu aduane bebra ubetimi enya cancer mpacho ya eye no kra na.
Bebre nye. Can no.
So ideally, if you wake up in the morning, unless you're doing intermittent fasting for health reason and answer to lose weight, you should try to eat something in the morning. Eating sometime around 2 or 3 o'clock is kind of late because then you miss breakfast and you miss lunch. Also, some people can develop what's called hypoglycemia, where you feel like you don't eat, so you feel like you're shaking, you start sweating, you start feeling very hungry. Sometimes you can get dizzy. So it's always advisable to eat early, have something in the morning. Even if you don't feel like eating something heavier, at least at least you fill up your stomach. Something ideally be like protein, a little bit of bread and non peanut butter, not something you can have to eat. Also for the canned food, as far as I know, a lot of the canned food, they use a lot of salt and a lot of preservative to preserve the food or whatever food that's in that can. For the salt, it's very, very high content in salt. So if you pick up, let's say, a container, I have a getaway here. Okay, and then you're looking up on the side of it. Now they'll tell you here how much sodium is on it. So you look and they see the sodium content. Now, under the nutrition facts, so make sure see a serving size. So then if he says 1 can, for example, and then the salt that's there, let's see, this one says 160. I didn't say it's for the whole thing. But if you look and then it says maybe 300, and our serving size is not the whole thing. I'm gonna say half a can and not half a bottle. If you eat the whole thing, you have to multiply that by however amount is in that container. So it has a lot of salt. So I think the common sentiment that goes around saying it can cause cancer, it goes with a lot of the preservative that's used. So if you look at the ingredient list, half of the things sometimes we can't even pronounce. So as much as possible, if you can do fresh, try as much and do fresh food. If anyone else has any contribution to that.
So, Doc, my question kakrawa. Mpacho.
Go ahead.
Na Ozempic na se abana mpacho se obi ni muye drukra na yese wonu ma betuma lose weight. Any ade sponsor bi omo wo siche any ade. Mpacho ni so etimi cause cancer. And that's
So with the Ozempic, yeah, in animal studies, it causes cancer of the thyroid, but it's never been reported in any human. But when they were doing their research before, when they did the research in the animals, it causes thyroid cancer, medullary thyroid cancer. But nipa certify cancer ni bi wɔ nipam. Nti for now, I mean the possibility of it causing cancer no ewo ho. Say betimi ama thyroid cancer, but enya hu wɔ nipam. But I'm one de na bi wɔ hu bi wɔ omumu. Enti kakra am work am so bi obi so a.
Yeah, so before you prescribe even the Ozempic and any of those class of medication, you always have to ask them if they have any history of thyroid cancer, any family history of thyroid cancer. And that's what Dr. Barima answered. And if there's any indication of that, you don't give it to the person. Also, if it's person that's prone to having constipation, say they don't go toilet maybe once a week, you will not get it because a journal, what it does is it slows down your digestive system. Maybe I will do all your intestine, it slows all the activity down. So you'll be out toilet maybe once a week, you can't get it. So that can cause you to have pancreatitis and have other problem where you can end up in the hospital.
Sandro, they had me power say manipa bebre bi otmunya diarrhea bebre bi ama winya yefunyare ne obo ama bofno na ofe bebre. That's the most common we see in the hospitals.
Thank you. The time is not on our side anymore.
Okay,
So probably one more question.
Yeah, Dr.
Bacho, go ahead.
Bacho, dear ma any power one or kuma. Ne content. Bacho, dear man causes her. Sakumano said they bought per yes, and I say run it. Bacho, dear man basam bacho.
And then there's a lot of reasons. So obisa, you might probably want to your EKG.
Yes.
But one is it could be maybe I find atrial fibrillation and I'll say atrial flutter. Thyroid issues and so friend palpitations. That's the other name for it. And see, it's better you go to get it checked. EKG, they can tell you obisu onya panic attack yakuma so timitu in terms of thyroid doswa. Hyperthyroidism can also cause say wakuma etu right.
Pacho medasipa na madam fubi kaso no onya bi ba doctor so ko check no enso hwe so o man ka hwe si hwe ni ho
you probably need like Holter monitor. I monitor on the show.
Yes, monitor. Yes, monitor. Yeah.
The shower or cardiologist will leave it on for maybe a week and I say no more, not omeji, and then they'll look at what is causing the issues. So yet me can say a baby multiple things. Yeah.
Thank you to our medical panel. Thank you so much. I'm sorry to interrupt, but time is not on our side anymore. Okay.
So can I ask a question related to what she asked about, please? I'm sorry.
Last question, and that's it. Okay.
Thank you. Well, Dr. Asiedu about potassium. If your potassium is higher, and also
potatoes. Potatoes could do the home casipa. Potatoes.
Orange juice.
Potatoes will be a but the home casipa, them say could do the potatoes that almost does pie to what is one. A beboa.
Pencil home.
The woman in Yakasipi, to say a walk could do pie potatoes.
All right, thank you so much to our doctors. Great job. So from what I've gathered from the discussion tonight, it says health screening is very important because they can detect potential medical problems. So it's very important that we do our physicals, okay? See your doctor whenever you have a problem. Don't try to treat it at home. See
Thank
your
you.
doctor, discuss your health issue with your doctors, and trust the doctors in the process. Thank you.
Thank you.
So now we're going to move on. I'm going to call on Father Abu Bonsra to come and lead us in prayer.
I'm here to share a doctor for ya Kenya no was in ya fano asopem na ya konyamia or ye bambo for any ya hoarding for Sir Onfanadom and an unhoarding MIA. And you may empire me no nampesi ya bo. Ye de nyamiase near Sarah de say, or my unhoarding soon fem and one fem. And the baby will be a sedid in honum dear or me.